UACCM Nursing and Allied Health, along with local medical partners, put together a mock crisis simulation for our nursing students as well as the EMT students. We have wanted to do this for several years, just as a way to pull things together and show them the different ways that different modalities in healthcare work together. It gave them the opportunity to see a variety of patients through the mock crash that we had. We had patients with various injuries, and the students got to work right there alongside of the EMT students as well as local EMTs.
So my involvement in the mass casualty simulation was actually a patient that needed to be med-flighted to the hospital. There was patients who were not hurt, but they were kind of a distraction.
My involvement in the crisis situation was, I was a patient. I played a dementia patient, someone's grandmother, so I really got into that role.
The EMT students were assessing those patients in the field and getting to do their part, all the way to loading them in the ambulance and bringing them up to our mock ER that we had put together, and passing off report, having to learn to give report to the nurse and tell them what their patient was suffering from. When the nurses took over care, then we had those healthcare providers here to show them, this is what it looks like in a real ER, as far as, these are the orders you're going to have, this is what your patient needs, and helping them work through the care of those patients.
I did get to see a lot of my classmates, how far they've come, because it was our last semester. Seeing them step into those roles, they were taking leadership, giving report. We had a really cool debrief after where everyone went into detail about their patients, and they all did really great. It was really cool to see that level of confidence in them develop compared to the first semester.
I don't get to see the paramedic side, the EMT side, the triage side. I've never worked in triage before, so being able to kind of see the, I guess you could say, controlled chaos where everybody has their own role, it really helped me as a student learn that when I am out there practicing as a nurse, that it is important to know my role in my facility. On any given day, anything could happen, and at that point, it's all hands on deck.
It gives us like a real life scenario, but in a simulation lab where we can fail, but we're not harming anybody, and we can go back and talk about what we did right and what we did wrong.
We had the perfect space for something like this. It was like, oh, those ambulances can come right up to those doors, just like that's our ambulance bay. And so that was kind of the vision, was, why not? Giving them that experience to see that critical care aspect of it, those are things you don't see a lot of in clinical. That's real life. You're gonna work hand in hand with EMTs and paramedics and different modalities of healthcare when you're out there doing your job as a real nurse.
The instructors, they really work hard for our success, and them all coming together to put the mass casualty day really meant a lot and shows that they want us to be successful nurses.
Seeing all of the work that they put into it, in addition to their daily tasks, really gave us the opportunity, I feel like, to put our hands in there where we could learn what it would feel like to be a part of something like that.
For them to put on that production for us, there was 2 graduating classes. So the LPNs were in their final semester and the RNs were in their final semester. It felt like a perfect opportunity to show all the skills that we had acquired throughout the year and really put them to use. It was something really, I think, that helped a lot of our confidence levels, like, okay, we're ready to go out into the real world and take on this role now.
I hope they gain some knowledge, some confidence to see that they truly are capable, and maybe settle the nerves a little bit, just to be able to pull from all that knowledge that they have and put it into practice. That's a huge component of it. We give them the knowledge, we give them the opportunities in clinical sites, but something like this doesn't come around every day. For them to be able to pull all that together and put it to use, I think is a huge confidence booster, and really lets them know that they're ready, that they are prepared to go out there and be a nurse.